Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. So you needed a chiropractor. Either you've never been to a chiropractor before and nobody's telling you which one to go to, or you've moved to a new area. You moved away from your chiropractor, or your chiropractor has moved away from you. How do you find the best chiropractor for you? You and I know, especially if you're a patient of a true chiropractor, we know when the nerve system is functioning at its fullest, when the spine is in alignment, your body will function to its best. You will perform at your best, whether it's athletic performance, your moods, your agility, your flexibility, your organ function, whatever it is, you function at your best when your nervous system is functioning clearly. And that is done through chiropractic adjustments. Here's the really interesting part. Some chiropractors do not embrace that philosophy, even though those are the tenets that chiropractic was built on starting in 1895. It makes it completely confusing. I know. So when you're looking for a new chiropractor, you're going to want to find a chiropractor that actually does adjustments. Some chiropractors delve into different areas like nutrition and exercise, and that's all great and fine and good, but it's not the adjustment. So that's the first question you would want to ask a prospective new chiropractor that you're thinking of seeing. The other thing you might want to do is find out what school they went to, because although many of us grow and learn beyond our education, the school that we went to sets the stage and the basis for our practice. I went to Life University in Atlanta, Georgia. There's 2 other Life colleges around the United States. There's also Palmer College, which has 3 campuses. There's Parker College. There's a lot of chiropractic colleges that base their treatment and their philosophies on the chiropractic adjustment. Here's the other tricky part, is that there is over 100 different ways to adjust the spine. There is not 2 ways, not 5 ways, not 10 ways, 100 different ways. And the ways to adjust the spine can vary greatly. They can range from very, very rough techniques, like on one end of the spectrum. I call them rack 'em, crack 'em techniques. And they work just like all the techniques work. They may not be right, that might not be right for everybody. On the other end of the spectrum are techniques that are very, very light, that use what I call doorbell pressure, or it might be the amount of pressure you would use when you would just press a baby's nose. Very, very light. Those techniques work as well. They're not right for everybody. Our techniques at Trimbley Chiropractic are somewhere right in the middle. I know both ends of the spectrum. I have experience with techniques that are on both ends, but for the most part, we practice with techniques that are about in the middle. So one of the other questions you might want to ask is, what technique does the chiropractor use? If you have experience with a specific technique, let's say it's Thompson technique, or cox flexion distraction, or upper cervical specific, you want to look for a chiropractor that does that. Also, you want to make sure that they actually do spinal adjustments. If you don't know what technique works for you, that's fine. Like I said, they all work. In my education at Life University, I learned 12 core techniques. 12 were an elective. So I have a broad array. I have a big toolbox of tools to use with my patients, so I can tailor their adjustments to them and what works for them. So good luck in finding the chiropractor that's best for you, putting the power and knowledge of your health back in your hands. Bye for now.